If you have a tooth react to cold, unlike the other teeth around it, it could mean that there's something going on with your nerve. And there's two things that the nerve is going to do. It is either going to get over it on its own, or it is going to need help getting over it, which is an irreversible process, meaning you're probably going to need treatment like a root canal. Now, if it gets over it on its own, all you're gonna need is time. Time will basically heal the tooth, and you're not gonna have to worry about it. It just slowly and gradually gets better and kind of gets over the situation. Now, the cold isn't actually causing the nerve problem, but cold is an indication that there is a bigger problem with the nerve that you didn't know about until your tooth started feeling a little bit cold. Now, when we talk about root canals, everybody is so worried about them. It's kind of like the worst news that you can deliver to somebody, that they need a root canal. But I can tell you, after doing hundreds, maybe even thousands of root canals in my own practice, they're not nearly as scary as you think. Essentially, when we do a root canal, the goal is to eliminate the transmission of pain from that tooth to the nerve, which goes up into your brain and gives your brain a signal, hey, something is wrong and this tooth is painful. When the tooth no longer can repair itself, we sever that and we basically remove the nerve and we seal it up. Look, when your nerve is damaged or inflamed, it'll give you like a feeling of sensitivity, pain to cold. And often what we're gonna do is we're gonna test your tooth to see how long the cold lingers on the tooth after we take it off. So for example, you come into the dentist, you say, this tooth is really achy and it is responding to cold. I don't like it. Whenever I drink cold things, it kind of hurts. What we're gonna do is we're gonna put a little bit of cold isolated onto that specific tooth, and then we're gonna take that cold off the tooth. And the amount of time it takes for your tooth to calm down after we remove it indicates to us whether the tooth needs a root canal or does not need a root canal. So I'll give you an example. We put cold on the tooth, we take the cold away, and your tooth lingers for maybe 30 seconds, maybe a minute. That's really going to indicate to us that this nerve is not going to get over this reaction of cold or the damage that's been done to it, and we're probably gonna recommend that you need to get a root canal. Now, of course, the entire time you are numb, so you're not gonna feel any of this, and that's a question I always get is, does this hurt? And it doesn't hurt because you are really numb when you get this procedure done. Take this tooth, for example. It's had a cavity go into the nerve, and it can no longer fix itself. So we're gonna take a burr. Of course, you're gonna be numb for this, and we're gonna take a burr, and we're gonna go in here and mechanically clean out the nerve. We're gonna mechanically clean out all the nerves. Now, then we're gonna take these drills and we're gonna widen out the tooth. So we're gonna hollow all the surfaces around where those canals are so that we can eliminate as much bacteria as possible. Now we're gonna put in several layers of sealer onto this root canal, and then that abscess at the end of the root is going to shrink, and that tooth is basically going to be severed off from any communication to your brain. So it can't signal pain any longer. And a lot of people ask me, what is it gonna feel like afterwards? It's just going to feel like the tooth did before, except you're not gonna be able to feel anything on it, like cold or pain or hot. Any of these temperatures you're not gonna feel on it, but it's gonna bite and function just like it did before the root canal. Now, this little green thing that we're using is called a rubber dam. Now, if you have a dentist that doesn't use a rubber dam, they are not practicing under the standard of care, because it has been very easily proven scientifically that using a rubber dam is going to prolong the life or the longevity of your root canals. And we basically place this on your tooth, and then afterwards we remove it, and then we seal it up, we put a filling on the top of the tooth, and the tooth goes back to normal. The other question I get as a dentist who's been doing this a very long time is, why do we even need a root canal, right? There are three main reasons a tooth even needs a root canal in the first place. Now, if it needs a root canal and you're starting to get this cold sensitivity, it is a good time to go into your doctor and not just ignore the problem. What happens is, if you ignore this problem, it's just going to get worse and worse and worse, and then you're gonna end up with a tooth that has an abscess. That's when you get swelling. So definitely take this serious and go in and see your doctor as soon as possible. The number one reason people need root canals is that the tooth has experienced some sort of trauma, like it has been in an accident, you bit down on a fork, something happened to it, and the tooth either dies right away or it takes several years for that tooth to slowly die. Once it dies, it's going to stop any transmission of pain. Number two is that the tooth has a bacterial infection. Now, a bacterial infection in part of the nerve will actually cause the entire thing to die, eventually causing a dental abscess. And no, you can't just take antibiotics and just clear this up. It's not that simple. You do need antibiotics and a root canal, or antibiotics and something else to actually clear this up. And the third reason people need root canals is that you have a cavity that starts either at the top of the tooth, maybe the side of the tooth, and actually infiltrates all the way down through the enamel, through the dentin, into the nerve layer. And once it gets into the nerve, now you're having symptoms, you're having that cold sensitivity, and it is too late just to do a filling or a crown. Now you're looking at doing a root canal.